Hi there, folks. Thanks for joining me. Jason Kenney here in Edmonton at the legislature, and I'm going to be taking questions from people on Facebook Live for the next hour or so on any issue that you're interested in. Obviously, we want to talk about the very difficult decision that we announced yesterday to put in place additional public health measures designed to protect lives and protect our healthcare system, while we as a province also stay focused on protecting livelihoods and doing our very best to balance these in an incredibly difficult time. Before I get started on COVID and your questions, though, I do want to point out that we continue as a government, as a legislature, to do the people's business. And it's important to point that out. The vast majority of Albertans continue to go to work every day and get their own jobs done and expect their elected representatives and their government to do the same. And that's why ours has been, just today, at 3 a.m., I was there in the Legislative Assembly and we completed our fall sitting, a very productive sitting. I just wanted to point it out because we don't talk a lot about the business being done, that we as a government continue to keep our commitments with Albertans on so many important issues. In fact, in this fall sitting, we passed all of these 15 bills. I won't go through all of them, but just to give you an example, a new policy framework for geothermal power in Alberta, the Builders Lien Act, which ensures, for example, prompt payment for contractors, tough on crime legislation, legislation to help streamline regulation for early childhood learning to create more daycare spaces in the province, a bill to that will help us to reduce premiums for automobile insurance by bringing in limits on certain damage awards that have been driving up insurance premiums, and much more. So this is important work that's being done. I'll just tell you that Alberta's legislature has worked harder than any other in Canada this year, including much more than the Parliament of Canada. We've had 78 sitting days in the second session of this legislature, which started on in March, and that we've had 554 hours of debate, which breaks the previous record in the 115-year history of Alberta. 19 sittings past midnight, including last night, 62 bills introduced, and so we are getting this very important work done. Now, having said that, I know that you want to start with questions on COVID, and why don't we just go straight to the questions so I can take as many of those as possible. So the first one I'll go to Devin Artson, says, how can businesses survive when forced to shut down? Thank you, Devin, and that is one of the reasons why we have been so reluctant to bring in public health restrictions that would shut down businesses, because the Canadian Federation of Independent Business, which is an important small business organization, has done a survey indicating 40% of Alberta's small and medium-sized businesses said they do not believe that they could survive a second complete shutdown. As you may have noticed, I have been, and our government have been, viciously attacked in recent days and weeks for not having imposed a lockdown in Alberta and indiscriminately shut down businesses. And our response has been that doing so would have huge damaging consequences to people's lives and livelihoods, to the broader health of our society. It would result in not only massive layoffs, but potentially massive business failures, dashed hopes and dreams. I spoke about these concerns at length in my statement on additional restrictions yesterday. But let me just say this, Devin, we have done the very best we can to, with these latest measures, to bend the curve down, to stop our healthcare system from being overwhelmed, while imposing the least possible damage on businesses. Now, it's true that many businesses have been suspended. Most recently, hospitality, bars, restaurants, and pubs. And that I've been, as you know, a strong defender of the responsibility of the hospitality sector. Gyms, fitness studios, personal services businesses, and others have been suspended. but we have kept all retail businesses open, and that avoids the mistake that I think other jurisdictions have made, and Alberta made a mistake in the spring when we made a kind of arbitrary distinction between so-called essential and non-essential businesses, which on the retail side essentially meant shutting down SMEs, small businesses, and moving traffic to big box stores because they sold essential things like food and pharma. We are not making that mistake, and so now in the Christmas season, those retail shops can stay open, limited a number of people that they can accommodate, a minimum of 5, 15% of fire code capacity, but this does create for a level playing field. It doesn't help, however, those many other businesses in the service sector that have been suspended. Why have we suspended them, especially after I've been such a strong opponent of, or I've been very clear that we should only restrict the ability of people to make a livelihood if there is no other option, only if it is a last resort. And we are now at that stage because as of today, well, certainly yesterday it was 650 Albertans in our hospitals. We're now up to 685 growth over the last day, 121 people in ICU. Now, our healthcare system has the capacity, and we can increase capacity to deal with numbers like this. We have 100 hospitals, about 8,500 beds, although many of them are for special purposes like maternity and mental health. We can't repurpose them for COVID patients. But we believe that we can make available somewhere in the range of 2,200 to 2,400 acute care beds for COVID patients and several hundred ICU beds. So while our 17 biggest urban hospitals are under increasing pressure, and many of them starting to approach 100% of capacity, we can, with very reluctantly, create more capacity by, unfortunately, postponing or canceling scheduled surgeries and other non-COVID related, non-urgent care, and then opening up those beds in those places. But so while we can do that, we can only do so much of that. And here, folks, why did we make these decisions yesterday? Against our strongest inclinations of imposing broad social damage through restrictions. Why? Here's why. Last week of October, we had 100 people in Alberta hospitals with COVID. Today, we have 685. That is to say, we have seen over 600% growth in just 5 weeks. And if the rate of growth continues to show up in our hospitals in this way, 685 will very quickly become 1,400. And then 1,400 can become 2,800 COVID hospitalizations. And once we're in that kind of terrain, then our healthcare system is under unsustainable pressure. Unsustainable pressure. There are only so many anesthesiologists who can be assigned both COVID therapy to support intubation in intensive care and do surgeries. There's only so many registered nurses who are certified to work in intensive care. There are only so many respiratory therapists to assist with ventilators and intubation, for example. Even though we have one of the most expensive and best staffed healthcare systems in the world and amazing world-class frontline professionals, there is, at the end of the day, finite capacity. So that comes back to the balance we've always sought to strike between protecting lives and livelihoods. Unlike some other jurisdictions that have taken truly extreme and sustained measures, I think most recently of parts of Australia, which became almost like a quasi-police state in some respects, SWAT team breaking up protests and arresting journalists and helicopters surveilling whether people stayed at home. Some jurisdictions have done that and trying to chase after zero. We have said that is not our policy goal because the cost to the broader health of our society would be intolerable. But on the other hand, we cannot allow the current trajectory of this spread, the velocity and speed of that spread to continue unabated because within a few weeks, we would reach the maximum capacity of our healthcare system. And so we've been left with only one option, really, in terms of our policy response to slow the growth in the virus and eventually to turn it down, and that is by limiting general social interaction. We're now at the point where it is so widespread, it doesn't matter how careful particular businesses are. In my comments yesterday, I commended so many amazingly responsible businesses, hairdressers. We didn't have a single, remember the hysteria that everybody was going to catch COVID by going to barbers and hair salons back in the summer? We don't have a single traceable case before our contact tracing was overwhelmed about a month ago. Bars and restaurants, we had only had 1% or fewer of traceable cases, 18 outbreaks out of 13,000 businesses. Casinos, since they reopened in June, to give you another example, we didn't have a single traceable case. Very careful protocols, thousands of employees. And so it was on the basis of that data and the great care of those businesses that we allowed them to continue to operate until this week. But we are now at a state where the velocity of viral spread is so wide that it doesn't matter how careful those businesses are. It doesn't matter how compliant their employees are with the rules. Employees and clients inevitably now will walk into those business places who are COVID positive, who do not know it, and who will transmit just through general social and community transmission. That is where we're at now. And if we put our head in the sand and pretend it's not an issue, we'll wake up at some point in January and we will discover that we have pushed so many COVID patients into our hospitals that we're unable to provide virtually any other health care. And the cost in lives as well would be staggering. That is why we made these reluctant but necessary decisions. Sorry, that was a very long question, but it really kind of was a summary of the rationale that drove our cabinet after great deliberation to make those decisions. The next question goes to Jane Cool, who says, can I have some clarification of the 15% capacity on retail? Does that include staff as well? We're talking there, I'm going to actually ask I believe I know the answer, but I don't want to misinform you. So I'm just going to ask our folks here just to check with Department of Health so I provide an accurate answer. And I will say this, they can have a minimum of 5 customers in. So a minimum of 5 customers. You can have a very small boutique, recognizing that they're at a size disadvantage, like 15% of fire code might just be 1 person. In that case, they can have a minimum of 5 customers. Joe Babin says, can our son who works in BC but resides with us come home for Christmas break while off work? Can the son who works in BC, well, Joe, the answer is that we have an absolute bar on socializing outside of your immediate household. So if he's a member of your immediate household and he happens to work outside the household, yes, he can come back home. If that is to say, if he's normally resident in your home, he can come home. But, and I have been speaking to our Chief Medical Officer, Dr. Hinshaw, about providing, she may be coming forward with advice tomorrow on how family groups can, if they're desperately important for them, to have family visitors at Christmas time to see whether we could follow the lead of some other jurisdictions in allowing for like a 14-day pre-quarantine period for families who feel compelled to do that. So just stay tuned for additional direction from Dr. Hinshaw. The 15% capacity limit does not include staff. That's what I thought. Just wanted to be doubly sure. We've confirmed that with health. Rose Plant says, are you keeping the pilot border program going through Christmas? Yes, Rose, we are. Alberta is the only province to have rolled out that program. For those not aware, it means that if you fly into the Calgary airport or arrive at the Coots land border port of entry, you can voluntarily enroll in the pilot. They will do a test, take a sample from you very quickly, and then you are required to self-isolate until you get your initial test results back. We understand that's happening in about 48 hours turnaround time. And if that if that initial test is negative, that you do not have COVID-19, then you can leave self-isolation and go carefully about your lives. But then you have to report back 7 days later to do a second test. We are providing that availability at drugstores across the pharmacies across the province. And we do the second test because there can be it can take a period of time, several days, for the virus to become infectious, to incubate, and we want to be doubly sure. I think about 4% of the passengers who are arriving, enrolling, and doing that initial test have come back as COVID positive, which is actually, I think, a very positive thing because it's helping us to catch and identify those cases earlier than would otherwise be the case without the pilot program. So yes, it will continue, and we still hope to be able to open that up to the Edmonton Airport in February as well. Michelle Clark Pace says, Mr. Kenney, how does the vaccination work? Is it done yearly? If you've already had COVID-19, do you still get the vaccine? So how the vaccine works is, first of all, there's so far one vaccine that's been approved by Health Canada. That's the Pfizer vaccine, and we are anticipating that the Moderna vaccine will also be approved and authorized for distribution in Canada. The Government of Canada, acting on behalf of the provinces, has large contracts with those two providers. There may be other additional vaccines that are still in their trial phase, which will subsequently seek approval and will be distributed in Canada. So I can only comment on Pfizer and Moderna. Both of them are double-dose vaccine protocols. I believe Moderna has to be, the second dose has to be done about 3 weeks after the initial dose, and I believe in the case of Pfizer, it's a 4-week gap between doses. When you, let me say that we'll have an announcement tomorrow about the very first wave of vaccine doses that we'll be administering. It will be focused on respiratory therapists and some intensive care healthcare nurses, for example, as well as people in staff in working with vulnerable patients in nursing homes. Then in January, February, March, we hope to be able to inoculate about 10% of our population, upwards of 400,000 people, again focusing on long-term care workers, intensive care staff, and the very elderly and frail who are living in long-term care and designated supported living, and then working out from there to other what we call congregate care facilities for seniors who are more vulnerable. We hope to basically have those high priority populations inoculated by the end of the first quarter of next year, and then move into phase 2, which would be the more general elderly population, and then from there in the summer move out to the general population. So you're asking if they need to be done do they need to be done every year? My understanding is that yes, likely this will have to be an annual vaccine, because what we know so far, what the scientists have learned about immunity from COVID-19 is that even people who have developed natural antibodies through a naturally occurring infection, they have some degree of immunity, but it appears to wear off after several months. Another key point about the Moderna and Pfizer vaccines is this, that there is so far no evidence that they reduce or inhibit infectiousness on the part of the person who has been vaccinated. What they have demonstrated with over 90% certainty in the trials, in the case of Moderna 95% certainty, is that they significantly reduce the typical COVID-19 symptoms. So what that will do is radically reduce the number of folks who get sick from an infection, and also reduce the number who, of course, pass away. So it reduces symptoms. We don't yet know if it reduces infectivity or infectiousness. And we do know these are double-dose protocols, and to be determined exactly how often, but my understanding is that they'll have to be administered on a periodic basis, like annually, as is the case with the regular flu vaccine. Josh Gardner says, "Hi, Premier. If cases do not stabilize, what is the plan for schools in the new year?" Thank you. Well, the plan for schools, first of all, K to 6 classes will remain for in-person learning in our schools next week until they come up to the regularly scheduled Christmas winter break. And as you know right now, grades 7 through 12, teenagers are doing at-home learning for the balance of this 2020 school year, calendar year. Then both K to 6 and 7 to 12, so all 13 years, are scheduled to come back for in-person learning in the schools on January the 11th. That represents a 1-week extension of the original school year, partly to allow for a kind of cooling off period, if you will, after students have been around their families, so that we can limit potential community transmission in the schools when they do come back. So January the 11th remains the target date. Obviously, through all of this, there is a certain degree of uncertainty in every aspect of our lives right now. That does apply to the schools. We are determined to reopen them on January the 11th, and we really do believe that keeping the schools open has got to be one of the key priorities as we avoid a full lockdown style policy in Alberta, because removing younger children especially from the social interaction, the in-person learning of being in class, it's a huge price to pay for those kids. It's very clear that it has mental health impacts. We also know that children have no statistically significant risk of becoming ill from COVID-19. It doesn't mean that absolutely none will, but it's not a statistically significant risk. And we also know that younger children are much less prone to transmit the disease, which is why we've been very keen about keeping the schools open. That will continue to be our position, even if we see continued viral spread going into January. All right, I see a question from, I think it's A.R.Renpa. I'm not quite sure how to pronounce that name, but please clarify details surrounding co-parenting access visits for Christmas weeks. I'd ask my staff here to perhaps get an answer for me from health. Once again, last thing I want to do is provide an imprecise answer to you, so we'll come back to you, Mr. or Mrs. Paw. David Smith, who is tracking the lockdown damage in suicides, alcoholism, death to delayed care. Well, the government is, David, thank you. We have been closely monitoring what we call non-COVID related health data since April. It's something that we wanted to follow very closely, knowing that restrictions have a negative impact on people's mental, emotional, and physical health, and also the general collapse in the global economy and energy prices on top of it. So the answer specifically is, can we put that question back up, because I didn't quite finish it? I know that you asked about suicides there. Okay, here we are, David. Suicides. So we are closely following that data. And I can tell you that for the first 6 months of 2020, we have seen actually suicides come down 19% lower than the 5-year average. And we published that data. You can see that online. In fact, if our folks can find it, please put a link on it in the comments section below. We've also been tracking, obviously, suicides since then, and they continue to be below the average of the last several years. We haven't done the final public run of that data yet, because we always go back to verify the numbers before publishing it, but suicides basically are down. I know that to many that's not intuitive, and it seems contrary. Like I have a friend who sadly took his life earlier this year, a high school friend. I believe it was related to all of this stress and the economic situation in part. And we have seen very sad local outbreaks where what the psychiatrists call ideation has led to strings of suicides, and most tragically in the Medicine Hat area. Our heart goes out to all of those who have been affected by this. But overall, province-wide, suicides are down. Now, we may see a delayed reaction. I think mental health experts often say that there is a delayed reaction in the mental health impacts to trauma and stress. And so perhaps all of the pent-up anxiety will manifest itself in an increase in that rate next year. But so far, thankfully, it's not been the case. And could you put back Michael's question? Or is okay, alcoholism. Well, I'm not sure how we measure that. I have not seen any data about increased admissions to hospitals related to alcoholism. We have seen alcohol sales certainly go up in our liquor stores, but that's, I think, not surprising under the circumstances. And death due to delayed care. Again, we're following that very closely. The last data that I saw, and we haven't seen this for about 3-4 weeks, was that we were actually below the average annual death rate for people over the age of 65. That is against the 5-year average, but we were above the 5-year average in deaths for the year to date amongst people under 65, which is really peculiar or counterintuitive given that the average age of death for COVID-19 cases in Alberta is 82. So it's why then would the death rate be up amongst younger people? And the answer appears to be the opioid overdoses. We've had, I think, we're approaching 500 deaths from drug overdoses this year, and there's absolutely no doubt that some of that, much of it perhaps, was driven by the policy response to COVID-19. We shut down the residential treatment centers in March that interrupted early stage treatment for people fighting addiction, and that clearly drove many of them back to drugs. Secondly, there has been a lot of evidence that federal income support programs like the CERB payments substantially increased the access to drugs for some addicts, and that likely also increased the fatality rate. So that is a case in point. So I just want you to know we are following all of that and related non-COVID related health data. In some cases like suicides, we have not seen an increase this year. In other areas like drug overdoses, we certainly have. It's just a reminder that all of this is complex, it is interconnected, and that at least some of these public health restrictions and policies have had a damaging effect on people's lives, in particular with the overdoses. Cindy Mouth says, just wondering about the army being dispatched in Alberta. Is this true? If so, why? No, that's, to coin a phrase, Cindy, that is complete fake news. It was a completely manufactured fake story from CBC, totally irresponsible journalism. I'm a former Minister of National Defence. We have, I believe, 3 deputy ministers in the Alberta Public Service who are former flag officers, the senior officers, generals from the Canadian Armed Forces. We have been in constant contact with the federal government. At no point, I repeat, at no point has there been any discussion between the Government of Alberta and the Government of Canada, between our Department of Justice and Solicitor General and the Federal Department of Public Safety, between our Emergency Management Agency and the Canadian Armed Forces. At no level has there been any request, suggestion, submission, proposal, or offer of military deployment in, as that story claimed, our long-term care centers. It is true that, I gather from that story, that a directive was issued for some reserve units to train for possible deployment to long-term care centers. And that order was executed in part by 1 Division, which is headquartered here at CFB Edmonton. By the way, the commanding officer of 1 Division is a former military aide to me when I was Minister of National Defence. So I know these folks very well, and if they were doing something, planning a military deployment in Alberta, we would know about it. They cannot do that without our request, and no such request has been made because there's not even been any discussion about the potential need for that. Now, it's true that in Quebec and to a lesser extent in Ontario in the spring and summer, they did call upon the Canadian Armed Forces to provide surge workforce capacity to assist in some long-term care facilities where they had significantly more deaths, significantly more outbreaks and deaths in those centers than we've ever experienced here in Alberta. And so I suppose that the Canadian Armed Forces, as a contingency plan, said, well, if it happened in central Canada, it might happen elsewhere. It could happen in Western Canada. And I'm inferring from that news story that they directed one div to prepare some relevant reserve units should there be a call from provinces for that kind of deployment. There is no such call, at least not in Alberta. One div does also serve most of the rest of Western Canada. So perhaps there's another province calling on them, but it's certainly not Alberta, and any suggestion to the contrary is simply a lie. Julie, but that's characterized a lot of the kind of coverage that we've seen, unfortunately, recently. I'll give you another example. Coverage about supposedly Alberta preparing to erect Red Cross tent hospitals for overflow capacity. Well, in point of fact, back in March, in the very first week of the pandemic, our cabinet committee directed AHS to look at to plan for potential extreme scenarios. Because we were looking at what was happening in Madrid, Milan, and New York, and elsewhere. And we thought we might be facing the same kind of pandemic here in Alberta, and that we needed to do at least some contingency planning for the most extreme scenarios. That included looking at renting convention centers and various other things. And at some point, I believe in the summer, the Government of Canada said, hey, as one of the many different kind of potential supports that we could help provide or offer would be liaising with the Canadian Red Cross for so-called field hospitals. And I think somebody at AHS said, okay, well, what would that entail? Just like other provinces have. Here's the funny thing. The New Democrat government of British Columbia did apparently exactly the same thing. They said to the feds, okay, well, give us more information. Under what circumstances? What are the arrangements? What would the logistics be should we face such an extreme scenario? And yet there was no startling headlines about BC about preparing to erect tent hospitals, because it's not true there any more than it is here. All right. So I have an answer. I was coming back to an earlier question from Mr. and Mrs. Paz. So there's no changes to policy with respect to co-parenting visits during the Christmas holidays. So it's the same policy stays in effect. Just 1 second, please. Next question, Julie Osiawi. I'm sorry, Julie, if I mispronounced your name. What is the current cycle threshold being used by AHS for the PCR tests? So, funnily enough, I was just reading a briefing note on that. So for those of you who don't know, PCR testing is pretty much the standard, and we get a lot of these questions about PCR testing. It's the standard testing protocol used in most parts of the world to identify COVID-19 cases. It is not a perfect test, and we don't pretend that it is. A lot of questions have arisen because, well, for example, Dr. Fauci in the United States, who's leading the public health response, has indicated that so back up a step. PCR test is where you take a sample from someone through a swab, for example. They take that sample, they put it in for analysis, and a key question about the sensitivity of the test is related to how many cycles it spins to identify the genetic material, which is indicative of COVID-19 in this case, because it does. PCR testing can be applied to other kinds of viruses. And so what Dr. Fauci has said is that anything over 35 cycles may produce false positives, that is to say, cases that where their test identifies dead or dormant viral fragments which are not indicative of infectiousness or the likelihood of someone to become symptomatic. So basically, Dr. Fauci has said with the PCR testing, there should be a degree of caution, and we should understand that we are if you're testing above 35 cycles on PCR, you're likely picking up a fair degree of false positives defined as people who are not infectious. Similarly, the New York Times published an exhaustive study in September, I believe, which concluded that as many, they did a huge analysis of PCR tests, and then they also did other testing of the samples with a scientific team, and the New York Times concluded that as many as 90% of positive PCR test results may not actually be infectious. And the takeaway from that and other articles, other research has been that policymakers should be cautious about calibrating their policy entirely on the basis of PCR tests. Now, a lot of this, okay, I know a lot of people are asking these questions because they believe that the governments, public health authorities, have created a so-called case-demic by, quotes, exaggerating the number of positive cases. It is absolutely true that many people who get a positive PCR test are not infectious, and many will never be symptomatic or will only experience minor symptoms. Here in Alberta, I understand that we test up to 41 cycles on the PCR, and anybody that gets over 35, we go back and run a second test on if they're positive. I've raised these questions emanating from Dr. Fauci, the New York Times, and other research on this. And I've raised this with the AHS, and basically they've come back and said, look, this is, I'll put it in layman's terms, they've said, we don't have data here in Alberta to conclude that there is a lack of correlation between positive PCR tests and infectiousness. And so we are confident that we're getting reliable results. Obviously, look, it's my job to ask questions, and it's also my job to trust the best medical advice that we're getting here in Alberta. So I probably spent too much time on that. I apologize. Let me just sum it up this way. I'm sorry for boring folks with all of this. I've been reading lots of articles over the recent weeks about PCR. Here's the bottom line. Put PCR testing aside. Let's put testing aside. Let's put the definition of what constitute cases aside. The metric that matters, the metric and the data that is driving our policy decisions is not the total putative number of active cases or positive PCR tests. It is hospitalizations, ICU admissions, and fatalities. So you could have, I don't know, in some ideal world, the most perfectly accurate test that only identifies cases that are or could become infectious. But so what? If you're piling up hundreds and hundreds of people in the hospitals and having to cancel surgeries and have ICU nurses working around the clock and hospitals operating at over 100% capacity, and if you're losing dozens of people every day to this virus. So I'm sorry, I took too long on PCR, all of which is to say that at the end of the day, it's not those numbers that are driving the decisions we made yesterday, it's the numbers of people who are in hospital beds, and more specifically in ICU. Because those numbers are not about false positives or abstractions about testing protocols. Those are people who have become very sick, they can't breathe, they are exhibiting major symptoms, and in a growing number of cases, they're losing their lives. So to all of the folks out there who think that this is all just some kind of a case-demic being driven by bad testing protocols, I'm sorry, that's not the issue. The folks in the hospital are the issue. Get back on track here. I'm sorry. Cheyenne Simpson says, I'm a student who lives alone. Am I allowed to go home to my parents' place for Christmas? The answer, Cheyenne, is if it's just your parents, yes, you could identify those as your two close contacts. Anybody who lives alone, who is single, lives alone, such as yourself, according to our public health guidelines, should identify two close contacts, and those can be family members who live in a different household, and those are your close contacts, because we recognize that the mental health, emotional health cost to making single people completely isolated is unacceptable. So that is a kind of a risk that's been built into our guidelines. If it's just your folks at home, you can do that. And I think that Dr. Hinshaw is going to be providing potentially more clarity about options around self-isolation pre-Christmas tomorrow. I'm laughing because I've got a question here from George Clark. Good to see you or hear from you, George. And it's non-COVID related. It's always a bit of a mental break for me to think about something else. What's going on with the carbon tax appeal to the Supreme Court of Canada? Thanks, George. Oral arguments were heard in September, and we are being told to expect a decision in March. So in about 4 months' time. I'm sorry it takes so long, but that's where it's at. Taya Johnson says, why did the lockdown start? And by the way, George, I know you always bug me for shorter answers. That was a pretty short one. I should have made a short one on PCR testing too. But Taya Johnson says, why did the lockdown start earlier so we could save Christmas? Well, Taya, first of all, these restrictions are very real, but I don't think they reflect a lockdown. A lockdown, at least in my books, is what they have done in the Aussie state of Victoria over much of the past 4 months. Stay-at-home orders. You can only leave your home for emergency essential purposes or like once or twice a week. Virtually all businesses shut down. Police patrolling the sidewalks. I mean, we have, despite the restrictions, far more freedom of movement, of commerce. Their churches, places of worship can continue to operate within 15% capacity. So we are not there, but the answer is, I'm often asked this, why don't you just do this so-called circuit breaker? Just bring in total lockdown for a couple of weeks, and then boom, we're all back to business, back to normal. I just say, that's just not true. I know it's a line that's been used by hardcore lockdown advocates to kind of, I think, lure the public into buying into that. I am not aware of a single jurisdiction in the world that has had a, quotes, short, sharp 2-week lockdown. So I'll just give you a concrete case in point. There's a lot of provinces that brought in more stringent public health measures than Alberta in October and November, before we did, who are going to have exactly the same rules around Christmas as we will have. So the fact that Manitoba, Ontario, Quebec, increasingly British Columbia, U.S. states that have had far more stringent rules all the way along. And by the way, almost all of those jurisdictions, you will not be here, you won't hear this in much of the media reporting here in Alberta, but most jurisdictions that have pursued far more damaging, restrictive lockdown-style policies than Alberta have had significantly higher rates of COVID-19 deaths, hospitalizations, and Ontario and Quebec, Manitoba, California, New York, pick your U.S. state that's had lockdown-style policies, France, Spain, Italy, the United Kingdom, go on down the list of European countries that have had extreme restrictions for far longer, far earlier and longer than we've had, almost without an exception, have had higher levels of COVID fatalities and hospitalizations than we've had. I hope that answers your question. I'll give you an example of the United Kingdom. The United Kingdom, about 6 weeks ago, I don't know about for you guys, but for me, time becomes a bit of a blur in the COVID time era. It was several weeks ago, maybe 2 months ago, that the UK went back to lockdown-style policies in many parts of Britain. And it was advertised as a short, sharp circuit breaker. I know in Wales, the First Minister of Wales announced about 5 weeks ago, short, sharp, 2-week circuit breaker. They're still in it. And across Britain, they've actually expanded the numbers of areas and the time that they will be under a much more restricted policy than Alberta. So I guess my point is, we don't want to give people false hope. We desperately hope and do believe that the measures we announced yesterday, layered on top of all of the other measures, both mandatory and advisory, will be effective in bending down the curve and protecting our healthcare system. But that will not happen overnight. It will not happen in 2 weeks. It's why we announced these measures are in place for at least 4 weeks. But I am absolutely certain that if we had announced similar measures 2 weeks ago, they would still be in place over Christmas and well into January. Leah Hamilton says, and that's, let me just go a little further. People say, why don't you do all of this earlier? Well, I was on a conference call that Dr. Hinshaw and I held with community leaders across the province last night. And she offered to them, I thought, a very pointed analogy. She said, as a physician, my training, I'm quoting Dr. Hinshaw here, or paraphrasing from her, she said, my training is when determining a course of treatment for a patient is to choose the minimally invasive course of treatment that will help to treat the patient. If that initial minimally invasive treatment isn't ineffective, I might step up to another level of invasiveness, but still try to avoid the maximally invasive course of treatment, because I don't want the cure to be worse than the disease. And she says, only then, if I was treating a cancer patient, for example, would I go all the way to the maximum invasive course of treatment for a patient that would inflict the greatest pain and carry greater risks. And she said, paraphrasing, she said, that's an analogy to what our approach here has been in Alberta. We have sought to gradually step up restrictions, to flatten the curve, while avoiding imposing greater widespread damage on lives and livelihoods in our broader society. So that partly, I think, answers your question. All right, Leah Hamilton says, can landlords evict for non-payment of rent during the next 4 weeks? Leah, the answer is that we had brought in tenant protection legislation earlier in the COVID era, and we have strongly encouraged landlords and tenants to work out agreements, because it's not in the interests of any landlord to kick out tenants who can't, when no one's available to fill those places right now. Obviously, we made some exceptions if there were tenants who were engaged in vandalism or damaging property and things like that, breaking the law. But those measures, I think they expired in August. And I must tell you, Leah, I have not heard from renters since then that this is a problem. If it is a problem, folks, please tell us, and perhaps we need, given the stringency of the most recent restrictions, we need to revisit that question. Ron Byman says, what are we going to do if there are any more anti-mask rallies? Well, Ron, it's not for me as an elected official to direct our law enforcement officials as to how they enforce laws. We have to maintain a clear wall between elected officials who effectively write the laws and the police and enforcement agencies who apply them. And so we'll leave it to those agencies to do what they think is take the appropriate response. I'll restate what I've said before, that I do think it's totally irresponsible at this time for people to be gathering in large numbers, especially if they're not making an effort to physically distance or to reduce the chances of viral spread by wearing face coverings. And I understand that many people feel very passionately about these issues and they want to speak out. I will remind them they have lots of ways of speaking out, almost an infinite number of ways of expressing their opposition to me, to public health measures, to masks, to whatever. If they want to go out there and say this whole thing was cooked up by, whatever the latest conspiracy theory is, 5G, Bill Gates, I've lost track. There's so many conspiracy theories out there. If they want to go and propagate their conspiracy theory, it is a free country. They can send me emails and letters. They can comment on Facebook, as I'm sure many are right now. They can do virtual rallies. They can do how about a drive-through rally? We've seen a protest. That's happened. People creatively have done that. Or in absolute, if they feel that the only way they can properly express themselves is to be in front of City Hall somewhere, then why not do it separated by 6 or 10 feet apart? Why not wear a face covering? Why not? The only reason you wouldn't do that is if you think COVID is not real. And I'll say to them again, if you think it's not real, then what the heck is going on with the 660 COVID patients in our hospitals right now, the 120 in intensive care, the 10 or more lives that we're losing every day? If you don't want to believe me because I'm a politician, fine, I get that. Why don't you listen to the nurses and the doctors who are there on the front lines? Do you think they're making all of this up? Do you know, I'll say again to those folks who are tempted to gather in large crowds right now, that this is, yes, you've got rights and responsibilities, rights, but you've also got civic duties and responsibilities. And how about just in an excess of caution, just out of a sense of care and compassion, you not get into a situation that could become a super spreader event? So we continue to make that point. All right, Corey Rocky says, will vaccines be mandatory or will vaccine passports become part of the plan? The answer, Corey, is no and no. Alberta will be actually repealing the law that since 1910 has allowed for the mandatory inoculation of Albertans. I don't think it's ever been used, but in order to remove some of the anxiety around this and hopefully encourage more people voluntarily to step forward and not feel coerced, we will be removing that provision from the Public Health Act in February. And we have no capacity I don't even know what a vaccine passport is. All I know is this, that it's illegal based on the Privacy Act to ask somebody whether they've received a certain medical procedure or not, including a vaccine. So the government of Alberta at least will not be participating in anything like that. All right, Karen Olson says, why were we not prepared for the second wave that was predicted over and over? Well, Karen, I would say that we have been prepared. Back in March, I talked about how the history of infectious diseases of this nature, like the Spanish flu that came back much stronger in the fall than in the spring. And that is why we took the time to surge our stockpiles of personal, think of all the issues we were talking about in March that we're not talking about now. Case in point, medical equipment, masks, surgical gowns, ventilators, other medical equipment. The world was panicking. We had Quebec within days of running out of surgical masks until we shipped them millions of units. And we had much better stockpiles, but they weren't infinite. So what have we done? We've taken this time to fill out our inventories of PPE, hundreds of even redundant ventilators that we have available, hired more, and we've gone from 35 contact tracers in March, then to 850 a month ago. We're on our way to 1,100 now to step up our testing. In March, we started with the highest per capita testing regime in Canada. I think we were doing about 4,000 or 5,000 tests a day. We thought that was really awesome. We're now pulling 21,000, 23,000 tests a day. So we were able to partner with the private sector, expand increase the productivity of our public lab system, surge orders for reagent and swabs and other equipment involved in the testing protocols. So now we're pulling by far the biggest testing numbers in North America on a per capita basis here in Alberta. We brought in things like the pilot program that helps us to identify more cases that arrive from abroad to avoid that as a vector of transmission. We've learned a lot about the disease and better treatment for it. Here's a critical thing. The case fatality ratio and the infection fatality rate have both come down significantly since the spring. That is to say, there was a much higher percentage of people who had tested positive in the spring that ended up dying from COVID-19 than has been the case in recent months, not just in Alberta, but around the world, because over the past 9 months, our clinicians have learned from what are their experience about what are the most effective courses of treatment. And so we're saving more lives, and that's good news. We've learned more about the infectiousness of the disease, learn more about how younger children have no statistically significant chance of risk to their health, which has informed our policy of keeping the elementary schools open, unlike in the spring when we shut them down in an excess of caution. So I could go on and on and on, but at the end of the day, we don't control the weather. The weather has a huge impact on the velocity of viral spread. It's why the fall always sees higher cases for diseases of this nature. People go indoors are closer together, spending less time outside. Cold weather seems also to help make viruses like this more virulent. And that's a circumstance we are facing with the rest of the Northern Hemisphere. So that is just a reality we don't control. And while we have been trying constantly to hire, train, and certify additional people to join our healthcare workforce in areas like respiratory therapists and intensive care nurses, there is a finite pool, both in Alberta and across the country. So I would say that we have taken the time. We took the time to improve our defense in long-term care centers. We provided nearly $200 million in support for wage top-ups and equipment and other support to help LTCs, long-term care facilities, to keep people safe. That has not been with, obviously, we have continued to see outbreaks, which is sadly, at some level, as long as you allow, unless you totally quarantine all of the staff for long-term care facilities and you allow zero visitors, which would be devastating for so many of those high needs folks. Unless you do those two things, there is going to be risk, especially if there's high transmission. Sorry, I got off onto a separate subject. I'll get back to the questions. Teresa Tondu said, how long are you anticipating these restrictions are going to be in place? Well, at least 4 weeks, Teresa, is what we announced yesterday. A couple of the restrictions began to be effective as of yesterday. Those are around province-wide mandatory mask mandate for indoor areas and workplaces, and secondly, what was the other one yesterday that became the ban on outdoor social activities. But the rest of the measures, including around business restrictions, 15% capacity at retail, hospitality businesses, personal services businesses, etc., those become effective on 12:01 a.m. this coming Sunday, so Saturday night, Sunday morning, is when they become effective for at least 4 weeks. We will reassess then. We will see whether we can return back to a regionally focused approach and whether we can move forward with any targeted relaxations at that time. The good news is the vaccine is coming. Stay tuned for an announcement tomorrow on that. And we hope to have vaccinated our most vulnerable population by the end of March. The bad news is winter is coming, and that is likely going to mean a prolonged period for at least some of these restrictions. All right, pardon me. Christine Lowe says, will there be any more surprise restrictions added onto these, or is this the worst it gets for Alberta going forward? Christine, we certainly hope not. Our hope and belief is that these measures, on top of the others we have taken, will, if Albertans rise to the challenge, that they will flatten that curve and protect the healthcare system from being overwhelmed. But if Albertans don't follow these guidelines, it's really not up to us, it's up to 4.5 million people in how they conduct themselves. It's actually up to a tiny minority of those 4.5 million people. We could have perfect compliance in 90% of the population, and if 10% just completely ignore the rules, we'll continue to have widespread transmission. If that small minority doesn't make an effort, if they're not, I don't want to say if they're not responsible, because I think, as I've said before, no one's going to be perfect in following all of these rules, and nobody intends to infect anybody else. Nobody's to blame. But let me just put it this way. If a significant minority of the population does not carefully comply with these guidelines and rules, and if the growth in spread continues to a point into January where it is truly threatening our healthcare system, then we would have to bring in additional restrictions, as much as I hate it. But we would be left with no choice, and it's up to Albertans. All right, Terry Denny says, Premier, I think if you had a mandatory mask order in March, we would not be in this position. Well, so first of all, Terry, there have been jurisdictions with mandatory mask policies since March, April that have had much, much worse records of transmission, cases, fatalities, etc. Masks are not, like they're a useful tool to help reduce transmission, but they are not the most important tool. The most important measure is physical distancing. Other basic elements of hygiene, covering your face, staying at home most importantly if you're sick, that's the most important thing. Washing your hands frequently. The masks add, as Dr. Hinshaw says, an additional layer of protection, in some cases reducing chances of transmission, but not eliminating them. And I'll just remind you, Terry, that in mid-March, when the World Health Organization, the Public Health Agency of Canada, and many in the Canadian media were strongly recommending against mask use, they were claiming that it was counterproductive. I publicly disagreed with that, based on partly on my read of the data emanating from East Asian countries, and we publicly advocated widespread mask usage, especially in crowded areas. We were the only government in Canada to actively facilitate that by procuring and distributing tens of millions of free masks, partly to normalize the whole idea. It's normal practice in East Asian countries. It's not in Alberta. And so we had to get people past that who aren't comfortable with the idea to become familiar with it, to socialize the idea. And as I've said consistently, I believe often you get better outcomes through, to quote Wilfrid Laurier, the sunny means of persuasion, rather than the harsh means of coercion. I thought it would be, for many people, counterproductive for us to feed into the political polarization around masks that we've seen in some other parts of the world, where some people would see non-mask wearing as some kind of a political statement. Did not want us to end up in that situation here in Alberta. Wanted it to be gradually seen as the normal, right thing to do, and I believe the vast majority of Albertans are there. In fact, our polling indicates about 90%. All right, Trevor Periton says, can you justify to us Albertans your new restrictions superseding our constitutional rights and freedoms? Thank you, Trevor, because I have been making this point all along, that these restrictions are a violation of constitutional rights and freedoms, specifically those enumerated in Section 2 of the Charter. And I am disturbed to find myself as one of the only political leaders in Canada who is willing to admit that. The leader of the opposition here in Alberta has just dismissed out of hand the notion that restrictions of this nature constitute the violation of rights and freedoms. Of course they do. I am even more disturbed that many in the media who focus in normal times obsessively on rights and freedoms, on charter rights. I was doing a radio interview this morning. They said, well, this isn't really an issue because you can justify these things. Well, hold on a second. How did we end up in a situation where we almost reflexively resort to abridgments, violations of enumerated constitutional rights, just because we just say the magic word pandemic? It's like what Simon Says or something. It's a magic word. Just say pandemic and then everything is justified, even potentially the most extreme scenarios. You know, some of the greatest violations of rights in our history have happened at times of real emergencies and fear and uncertainty. Not to draw an exact analogy, but I can think, for example, of the FLQ crisis, 1970. There was some violence, a couple of kidnappings, and the then government brought in effectively martial law and detained thousands of people without warrant, without habeas corpus, in absolute violation of ancient freedoms. And people said, well, it's justifiable because there's an emergency. It's exactly when there is an emergency that we must be most careful and most deliberate about how and to what extent governments abridge fundamental rights and freedoms. That has in part informed Alberta's response. Now, to answer your question more kind of in a legal way, Section 1, you can go Google the Canadian Charter of Rights and Freedoms. Section 1, and I'm going to paraphrase here because I'll probably get a couple of the words wrong, effectively says that the rights and freedoms in the Charter apply but can be abridged if that abridgment can be reasonably justified in a free and democratic society. So the rights can be abridged, limited, violated, if you will, if that abridgment is reasonably justifiable in a free and democratic society. Now, those are pretty vague words, but the courts have spent over 35 years of defining what that means, reasonably justifiable in a free and democratic society. And basically, to simplify it, they've said that for government to do that, it must be for a specific, compelling policy reason, that the response is proportionate, and that it is limited. So in this case, there is a compelling rationale, right, which is public health, which is preventing the total explosive impact of a deadly pandemic. So I think that is fairly obvious, prevent the overwhelming of the healthcare system, et cetera. So there is a specific policy goal that is compelling. Secondly, question is it proportionate? That's a hard question to answer. And thirdly, is it limited? Is it a limited impairment? And I'll give you, I've said this before, I'll give you an example of how we've tried to work this out. A lot of the people who wanted to lock everything down from day one, by the way, it seems to me a lot of them, I'm sure many are all of them, I'll be generous, are well-intentioned, but I suspect many of those people are not actually losing their life savings or the exercise of their fundamental freedoms when they advocate for these things. But I'll give you one example. Some people have wanted us to completely shut down houses of worship, even though Section 2 enumerates freedom of religion as the second fundamental freedom guaranteed by the Constitution. Obviously, the freedom of worship is inextricably a part of that freedom of religion. And so we have said, look, because any gathering at all can potentially lead to transmission, we have to restrict the number of people who come together in places of communal worship to do everything that we reasonably can in a proportionate way to reduce viral spread, but in a way that limits the abridgment of the freedom of religion. And that's why, unlike other provinces, we've come up with right now a 15% capacity limit with various public health regulations around how worship is done. That is to say, long story short, here in Alberta, we've said we will respect that right. Unfortunately, we've had to impair it, limit it, but we've not completely violated it like some other jurisdictions have done, I think, hastily. And, you know, it's interesting. This more goes to the field of administrative law than constitutional rights, but the Superior Court in Ontario ruled earlier this week that the public health orders shutting down small retailers is unjustifiable and not proportionate to the rule that allows big box stores to operate. So the courts are getting, and in many U.S. courts, all the way up the system to the U.S. Supreme Court have ruled that public health restrictions which allow, in some states, casinos and strip clubs and Walmart to operate, but completely shut down places of worship, that is not proportionate. So judges across the world are grappling with these issues, and I'm glad that our elected government is too. Richard Gill says, I'm a contractor who does residential construction work. Is it okay to go into people's homes where they are living and do the work? The answer, Richard, is yes. The restriction does not apply to home maintenance and repairs. As people I asked people to go to the BizConnect link, and it provides all the details. We'll also put a link below. Trajan Ogden says, what is the deal with the outdoor gatherings? You said they are prohibited, but then said outdoor rinks will remain open. How does that work? Okay, good question, Trajan. Specifically, we have prohibited private outdoor social gatherings, much like we prohibited private indoor social gatherings. When you take your kids out to go skating on an outdoor rink or a pond, or to go tobogganing, and maybe you happen to see friends or whatever, other people on the hill, on the ice surface, that's not a social gathering. We ask that you try to maintain some physical distance. If you go out for a walk and you pass your neighbors, your friends, and you say, how are you doing? Nice to see you. That's not a social gathering. It's a spontaneous exchange. But if you call up your 10 best buddies and say, let's get together in the backyard for a fire pit and some beers, that is a social gathering. Okay, so I hope that people see the difference. Outdoor recreational activities permitted within certain guidelines. Social gatherings are not. So that's parties, getting together purposefully. So I hope that's clear. All right, Jason Stapleton says, why close gyms instead of just cutting the capacity like you do for retail? We did cut the capacity, Jason, 2 weeks back in our latest round of restrictions to 25%, and we were hopeful that would be good enough. And I know that gyms are a big part of people's physical and mental health, and I know those gym owners are going to be really hurting right now. And again, these were kind of last resort decisions that we made. Bottom line is very simply this. We simply have to reduce as much as we reasonably can any kind of facilities where people will be coming together and where the virus can spread from one to many. Obviously in gyms, even if they're distanced out. People are working out, they're doing aerobic activity, they are projecting, and when they project, when they breathe out, they are distributing these little droplets. That's the main means of viral transmission. So it was just, here's the problem. We could look at any single different kind of activity and say, well, let's accept that one, let's accept that one, let's not. And we just had to come to a decision that this is becoming a crisis in terms of the impact on the hospitals. We just have to slow everything down, and that's what we've done. On the retail side, Jason, as tough as it may be for many people not to be able to get to the gym for a while, obviously people have to be able to go to the grocery store. They have to be able to pick up their pharmaceutical drugs. There are certain other essential supplies they need to get. If your boiler blows out in the winter, you need to go to the hardware store and buy parts, whatever. So you cannot completely close retail. So on the retail side, the only way, the only approach we could take apart from the 15% limit, which applies to them all, would be to go back to where we were in the spring, where we designate stores that sell food, pharmaceuticals, hardware, and some other things as essential, which basically meant all those little retailers with specialty products were wiped out, all their money went to the big box stores, and that just wasn't right. So we decided on the retail to take a slightly different approach, but recognize that much of retail is essential. Obviously not all of it. All right, I've been 1 hour and 50 minutes. I'll just take a few questions. You know what? I really should try to be faster in some of these answers. I apologize. Thank you for your patience. I'm going to try to do a rapid round here. Just see if I can give 30-second answers or less, right? Glenn Schwartz, what do you say to the poll that 30% of all Canadians who ignore travel bans and see family, that is roughly 10+ million people, how do you police that? Realistically, Glenn, I don't think there is a way of policing it. This is a free society. And unless we want to become a police state and have police roadblocks and tell people they can't leave their immediate neighborhood, as they've done in some other jurisdictions, and God forbid that we should end up where they are. So I guess what I say is people, if they want to avoid that level of coerciveness, then they've got to act responsibly. April Lott says, are antibody tests coming anytime soon? I personally would be excited for the data as natural immunity is proving to be much more enduring than first thought. Thank you, April. I sure hope so. I've been calling on the feds to release rapid antibody test kits since April. I think they've done that for one or two. Those tests have proven not to be nearly as accurate as PCR but certainly for if they're assessing people who are currently symptomatic. But for those antibody tests, I think they can be an additional tool that could be used in some context. We hope that gets approved very quickly. Carmen Labrie Hurtubise says, what's the scientific explanation of why there is no flu this year? The best I've read, Carmen, is that all of these public health measures, the distancing, the staying at home if you're sick, all of it together has suppressed the flu down to basically nothing, the regular seasonal flu influenza. Plus, we've had higher levels of vaccination this year. The flu is less virulent than COVID-19, and it's certainly much less fatal. And on this, some of the COVID skeptics say that basically COVID-19 is just the flu or something like that. It's just a different name. Folks, not true. We have lost over 600 lives in Alberta in 9 months to COVID. On a bad year, we'll lose about 90 people to the regular flu. So we're already at over 6 times the number of average annual flu deaths. This is not the regular flu. Christina Fisher says, what are all those signs I keep seeing all over Calgary about saving our provincial parks? Yeah, I think that's a campaign by a interest group that falsely, I mean, they're very effective at fundraising. I give them credit. They are tied to CPAWS and I think the Tides Foundation and all these groups. And they're claiming that Alberta intends to privatize our provincial parks. That is a complete categorical falsehood. There is not a grain of truth to it. We are taking some of the parks that are particularly remote, don't have a lot of commercial, a lot of demand in terms of visitors and stuff, and we're seeking partnerships for their operations with First Nations, municipalities, local park societies, etc. We are not selling parks, and we will not be removing the protected status of public lands of that nature. Richard Laycock, what is the deal with the new license plates? When do we change them, and are there any additional changes? So license plates, stickers are being eliminated. The stickers are being eliminated. New, more reflective plates will be gradually phased in with the same design as the old plates. This will help law enforcement to track stolen vehicles. There will be no additional changes. And the Flames and Oilers in Support Our Troops plates are already reflective. Keep going here, because I am picking through a lot more questions now that I'm making the point of it. Becky Bozarth says, how about caring for those who are losing their businesses? Thank you, Becky. Absolutely, and that is why yesterday we announced a quadrupling of the Alberta small business grants to be able to receive up to $20,000 in support if you've experienced a loss of 30% from your 2019 revenues, and people will be able to go back and date these applications to March, beginning of the pandemic. In addition, the federal government has expanded, with our participation, a more generous rent subsidy, commercial rent subsidy program, and the wage subsidy program continues in place as well. Some of the restaurateurs were telling us recently that if we force them to close through this order, they would be able to they would do better financially from all of these supports combined than losing money staying open when very few people were patronizing them. Michelle Rapley says, does a social gathering include a walk with one other person? I think I've already addressed that. The answer is, well, with one other person, the answer is if you maintain social distance, you're good. You're good to go. Stay a few feet apart from your friend, or if you're a single individual, you can walk to your heart's content with your two close contacts, or your, for that matter, your immediate household, if you live with family. Tammy Egland Plum says, how are you evaluating the mental health effects on our children with the lockdowns that are impacting them? It is hard to do that, but Tammy, I've seen a lot of research showing that there has been very dire negative health effects. One of the ways we're doing it, responding to that concern, is by keeping the elementary schools open. You may recall back in the fall, the government was viciously attacked by various interest groups for reopening the elementary schools. It was absolutely the right thing to do for the mental health of children, as is keeping open the childcare centers. And I want you to know that one of the first things our government did was to provide over $50 million in additional mental health supports for community-based organizations dealing with children, adolescents, and grown-ups dealing with mental health stress. Jessica Terrace says, is it possible for me to use my parents and in-laws as childcare? You know, I'm going to, again, I think I know the answer to that, but I'm going to get back to you, all right? Terry Denny says, are you exploring the potential for lithium in our province? Yes, Terry, and in fact, one of these, I think 15 bills that we just passed through the legislature supports our new mineral strategy. We have a lot of rare earth minerals, and we think there's great potential for that, unrealized because of all the focus on oil and gas in the province in the past. And so we are creating a regulatory framework to facilitate exploration and a potential future development of lithium and other rare earth minerals. Andrea Elias says, would you have run for premier if you knew it would be during a worldwide pandemic? Oh boy, I'd have to think about that one. I certainly didn't think I was signing up for this. These are decisions I never imagined I would have to make, but it is just the burden of leadership at our time, and we all have to do our part, and that's just where I am. I remember asking Dr. Hinshaw early on, did you ever think when you became the chief medical officer that you would have to preside over the response to the biggest pandemic since 1918? And she didn't think she was signing up for it either. But I guess, you know, I know there's a lot of criticism, and that's fair. It's a free society. Criticize away if you feel you're compelled to do so. But I also just want to say thank you to the many folks, even if they don't agree with everything that I or our government have done, for many people, for just being very generous in their comments, supportive, expressing just, you know, moral support. When I'm out in the grocery stores or whatever, I'm always touched by people who come up to me and just say, thank you for your service, thanks for what you're doing. So we truly appreciate that. But most importantly, let us thank our frontline medical personnel who are doing the really heroic work here every single day under increasingly difficult circumstances. And you know, with that, I think we've been nearly an hour and a half. I'll try to do another one of these next week. Thank you folks for your good questions. I really appreciate your input. Stay safe, take care of each other, and let's get through this.